Hi students, welcome to the next video. In this video, we will discuss about basal cell carcinoma. Basal cell carcinoma is a very small topic, right? No much questions they ask from basal cell carcinoma, but you have to know what is basal cell carcinoma and what is it related to, okay? And where they can ask questions from. Basal cell carcinoma is the most common skin cancer. Okay, it's the most common skin cancer. Is your basal cell carcinoma? It mainly comes in the skin on the face region where there is more of UV light exposure, right? So it's not the squamous cell carcinoma which is most common. You may be seeing squamous cell carcinoma a lot, but basal cell carcinoma is the most common skin cancer. And on the face, it has a high chance to come. Okay, on the face, or in the lip region, okay, on the forehead, where there is UV radiation exposure. Okay, there is high chance that you can see a basal cell carcinoma. And basal cell carcinoma, usually you can see this picture. It appears like a small ulcer and it is burrowing in type. Okay, it appears like a small ulcer. And the feature of this basal cell carcinoma is that it will invade or it will burrow inside. Okay, it has a penetrating type of invasion. Okay, it is called a burrowing invasion. It is burrowing, just like who is burrowing, rats. Okay, you may see the rabbits, etc. They are making burrows, right? Burrowing invasion. Okay, so that way it's called a rodent ulcer. Rodent ulcer means rodents are the rats or rabbits. Okay, they make the burrows inside the sand, right? Similarly, you can see that this ulcer, it is penetrating deeper or it is burrowing type. So that's why we call rodent ulcer. It is locally invading or locally aggressive. And you can see some enlarged blood vessels on the top. Okay, just like a spider's a leg. Okay, the spider navy like blood vessels, etc. is seen. These are all features of this basal cell carcinoma. Okay, and if you see the histology, what you see is that you see so much of basal cells. These are all basal cells. Okay, islands of basal cells. Basal cell, basal cell, it is a columnar to cuboidal cell with a deep dark blue nucleus. That's why it is called a basal cell. It is very dark blue nucleus, and you can see islands of it, invading islands of this basal cells. Now there are certain questions. The gene which is usually seen mutated to the basal cell carcinoma, that is your PTCH gene. So you may have seen the same gene in one of the syndrome, that is your basal cell nevus syndrome, PTCH, or OKC, where there is multiple OKC and all. Okay, if try to give a brain exercise. We have seen OKC, multiple OKC. We have seen the basal cell nevus syndrome. In that, there were multiple basal cell carcinomas, right? The same one. Okay, this is that tumor. This is that epithelial tumor, and there is so many syndromes. One is multiple basal cell carcinoma syndrome, that is your basal cell nevus syndrome. Then rombo syndrome. Okay, rombo syndrome, Bayes syndrome. Okay, rombo Bayes. Okay, so many syndromes are there which is related to this what basal cell carcinoma. And histologically, there is certain things you should know. Histological types of this basal cell carcinoma is that they are different types of histological types of basal cell carcinoma, out of which one is nodular type basal cell carcinoma, and pigmented type is there, pigmented basal cell carcinoma. Morphiiform is there, morphiiform basal cell carcinoma. And there is one called micronodular basal cell carcinoma, superficial basal cell carcinoma. So many histological types are there. Now, out of which the most common one is the nodular type of basal cell carcinoma, and most aggressive or worst prognosis is for the morphiiform type. Okay, so morphiiform type has the worst prognosis, and nodular type of basal cell carcinoma is most commonly seen. Okay, so this is just about your basal cell carcinoma. Nothing much is there. You should know the syndromes which is related to this basal cell carcinoma, and the location mainly on the face region. Okay, in the above the alatragal line and all, a face region. It can come anywhere on the face region, mostly above your alatragal line, on the forehead. Okay, on the nose or lip region. So they will give you clinical clue that the person is having such kind of ulcers with a enlarged blood vessels over it. Okay, that is spider navy like blood vessels. Yeah, so this is about basal cell carcinoma. So this is a short video, and see you in the next video with the next chapter. Okay, bye.